week 26. We only have 14 weeks left to go, but technically 13 weeks because I am supposed to be induced 1 week early. So depending on how you think of it, we've got 13 or 14 weeks left. Week 26, baby's eyes are forming and the eyes will soon open, and eyelashes are now growing too. Baby is getting his or her immune system ready for life on the outside by soaking up antibodies. Baby is growing about 14 inches long and is about 1.5 to 2.5 pounds. My body at week 26? Trouble sleeping. The closer you get to your due date, the tougher it might be to get some rest. Swelling. This also might not let up for a while. Headaches due to hormone fluctuations or stress. Pregnancy brain. Is it getting tricky to remember stuff? Braxton Hicks contractions and slightly higher blood pressure. So week 26 was kind of an adventure. Some of the things I've talked about in the past is that I pee when I sneeze, my boobs started leaking, and I have sciatic nerve pain. Now I haven't peed when I sneezed in almost 2 weeks, but my boobs are leaking to the point where I actually had to go out and buy special pads to soak everything up. Otherwise it would just kind of soak through my bra and soak through my shirt. Like, it is really, really bad. My sciatic nerve pain has gotten awful. It hurts to do pretty much anything, and it's mostly in my right leg. My left leg and my hips and everything are fine. It's my right hip and my right leg the whole way from just the lower back the whole way down to my toes. The worst thing for me to do right now is to drive. Sitting in a position like that and then with your feet kind of flexed up to hit the accelerator, it hurts really, really badly. So the worst times for me are when I'm driving to work, driving home from work, driving to my dog's training classes, just anywhere in general, it hurts. The most comfortable position for me to sit in is Indian style with my legs crossed. Even sometimes laying down hurts, especially if I'm laying on my sides. Right now, laying on my back is kind of the most comfortable for my legs, but then it's not the most comfortable for the rest of my body. So it's been kind of interesting. I had some blood work done, and it turns out that I am Rh negative, so I'm not sure if Danny will need to get some blood work done or not either, but regardless, I probably have to get 3 doses of a specific shot, because if the baby's blood is positive, and once I deliver the baby, my body will start making antibodies to the baby's blood, and then if I were to get pregnant with a second child who had positive blood, my body would start attacking the baby. So if that is anything that you have had or you're familiar with, it is Rh negative. If you are positive, you don't have to worry about it at all. It is only Rh negative, and I have that, of course, right? Of course I have that. So one of the really important things that was supposed to happen was my glucose test. Now, if you watch the daily vlogs, you already know I did not have the glucose test done. I went over the weekend to get the glucose test done, and you have to drink this really sugary liquid. And the options they had were orange or fruit punch. And I am allergic to red dye, so I could have neither one of them. The hospital had no other options for me. And for a hospital, you'd think it would be really important to cover all food allergies. You know, you wouldn't want to do something with nuts in it or dairy. You know, some people have severe allergies to nuts and dairy, and I have an allergy to red dye. So, first of all, why does the drink have to be dyed? The dye does not add anything to the flavor. So yeah, it's fruit punch, but why can't it be clear? There's no reason to have it dyed red, or the same with the orange. There's no reason to have it dyed orange. If it's just a mental thing that fruit punch is supposed to be red and orange is supposed to be orange, then grow up. We're adults. Like, we don't need our sugary drinks to be flavored and dyed. So I could not get the test done for that reason, and that's a really important test. So that really made me upset, and my mom and I called around to every lab that we could think of in the area, and none of them carry the clear liquid. So I spoke with my doctor on Monday, and they are going to order in the clear liquid. Now, the reason that they say they don't use a clear liquid is because it's so gross that most people end up throwing it up before the test is over, and then it just makes the data invalid anyways. So the test can't even really be done. So I guess I'm just going to have to kind of push through it and not throw it up, keep it down. I don't know, but still, it's ridiculous that the other ones are dyed like that. I mean, especially for a hospital to not really consider all food allergies like that is just kind of mind-boggling to me. It just blows my mind. If you haven't been watching our daily vlogs or our name reveal videos, then you do not know which names that we have removed from our board and what names are still on there. So go check that out. I'm not going to tell you which ones I've removed, but we have removed 4 names from each board. Yeah, 4. I couldn't remember if it was 4 or 6. We've removed 4 names from the boy board and 4 names from the girl board. And if you'd like to watch those, definitely check out our daily vlogs or follow us on Facebook. We post just the little clip of us removing the names off the boards on our Facebook page. I've started setting up our hospital bag, which for 26 weeks sounds a little bit ridiculous. However, in my family, there were some preterm labors as early as 28 weeks, and I know 2 people who have gone into preterm labor at 32 weeks in the past week. And that to me is just really scary. I don't want to be in that position and not be prepared for anything. So I've started putting my hospital bag together so at least we have something that we can take with us if that were to happen to me as well. Other than that, I still don't really have any symptoms like being nauseous. I don't have any swelling. I still haven't had any food cravings, aversions. My headaches have actually been really good. I haven't had any headaches in a really long time. I'm still really, really hungry. If you watch the vlogs, you saw the breakfast I had the day of the glucose test. That was after I was supposed to take the glucose test. Of course, I didn't eat like that prior to the glucose test, but I had 3 eggs and 3 pieces of French toast and a drink, and it was kind of crazy. So I am still a bottomless pit that can just inhale food like it's never going to stop coming at me. I don't know. I think that's about it for week 26. Like I said, nothing too exciting is going on still. I'm still waiting for those weird symptoms to kick in, but so far it's just sciatic nerve pain, peeing when I sneeze, and leaking boobs. So I will see you next week during week 27 when maybe I'll get some even more bizarre symptoms that we never even considered. I will see you then. Bye!